Hi, everyone. So my name is Pooja Pandey Rana. I work for Helen Keller International, and I'm based in Kathmandu, Nepal. I'm also a member of Campaign Integration Working Group. So today I have a privilege of being a facilitator to deepen our understanding and a conversation on collaborative planning for integrated campaigns. So for our breakout session today, we'll focus on one key question, which is how are decisions about integrated campaigns made? I think based on our experience, we know ideally, decision makers should assess feasibility, risk, benefits of campaign integration across all components. Decision makers should co-create a solution, based on evidence, information, diverse stakeholder input. But we know in reality, in many settings, this may not be the case. So maybe I can kickstart with a question based on experience. Experience in working with different integrated campaigns. How are decisions made on integration? Who initiates these discussions, and who are some of the important stakeholders at the decision-making table? So it'll be great to hear your thoughts. I also encourage us to not just to think decision-making at the policy at the national federal level, but also at the subnational and local level. So it'll be great to hear your thoughts on this or your experience. Anyone? So maybe I can begin with,
sorry, a couple hands.
Alan Brooks.
Oh,
Alan, you can turn on your camera and your microphone.
Please go ahead.
Hi, everyone.
Yes, please go ahead.
Yeah, sorry. I'm sorry. I'm away from my desk at home, so the camera will be quite distracting for everyone. So apologies for that. I guess the reflection I wanted to bring to the table is that the essence of an effectively integrated campaign from our experience, and I work for an organization called Bridges to Development, and we work in a number of different areas, but most recently are working in Vanuatu and PNG, is looking for those opportunities for the win-win. The piece where actually both programs, both sides of the equation have really concrete benefits and values and outcomes. And if you don't start from that point of what's the win-win, what does each get from the integration, whether that's just collaboration or actually full on integration, then it becomes harder for it to be realized, let's say. Over.
Great. Thanks, Alan. Martin, I can see your hand raised. Please go ahead.
Yeah, so I just want to give an example from what we had. Okay, my name is Martin Omodo and I'm from Kenya. And I think we are currently in the midst of kind of going through that phase of integration. So we find ourselves in a scenario whereby LF and Shisto MDA was supposed to be happening around the same time. But at the same time, we are also planning to integrate Shisto FGS intervention within the primary healthcare service delivery. And just like Alan has pointed out, I think the first point, okay, for Shisto and LF, the value we were asking, we were kind of proposing or suggesting was cost saving. And so the question was, who are you saving cost for? And I think it needs to be very clear, because we are two implementing partners. And sometimes more so when you're operating through the government, they think like you're taking resources away from them. And I think you need to be very clear from the word go. Okay, we are saving some money or saving on resources, and these resources can be used this way. And then for the FGS integration into the cervical cancer screening, I think also it's just showing them what is the value of doing that and how does that fit into the bigger picture of healthcare service delivery and all that stuff. So that has been my an experience at the moment. But the other challenge will be also just trying to marry each partner's interest. So as different partners, you come to the table, but each one has their individual interests, and also the donors' interests are also at play here, more so if they're two different donors. So how to bring these things together becomes, very critical in that planning phase.
Yeah,
Thank
those
you.
are great points, Martin. I think cost is how cost effective it is, how expensive it is. It's going to be very important for decision makers. Giovanna had her hand raised earlier, I think. Okay, no.
C'est plutôt un commentaire.
Yes, please go ahead.
Je peux parler en français? Bonjour, Puja.
Can I speak in French? Good morning, Puja.
Hello.
Ok, de l'équipe régionale. Je suis Romance Tisseka de l'équipe régionale de Helen Keller International pour la supplémentation en vitamine.
So we are working on vitamin A, and I wanted to come back on a comment. We do campaign, and we have this. We work on resource optimization to integrate the supplementation of vitamin A. So how can we optimize resources, because they're very scarce, and very often, especially for vitamin A supplementation, countries do not have enough financing to have a separate campaign. And one of the challenges we have is the interest. The gentleman from Kenya spoke about interest, but the interest of the Ministry of Health. These activities are in two different divisions in the Ministry of Health, and we have to increase the interest to integrate these activities for the Ministry of Health. And when it comes to the district or regional level, generally these decisions are made in at the national level, and they are applied at the local level. And maybe we can get them involved in the decision making, because when you work on the implementation, these actors are very busy on with other activities. So sometimes you can have several activities going on at the same time. So that was my comment regarding integration campaigns. Thank you, Puja.
Great, excellent points. I think maximizing resources is going to be critical. Alusula, can you please speak?
Yes. Yes, thank you. Thank you, Puja. I just also wanted to just say a few things about how decisions are made concerning campaign integration. And I think one of the things that also drives decision making is when you have an intervention that is effective, but the coverage of that intervention is very low. But then you have another intervention which has very high coverage and is targeting the same age group that the other intervention is also targeting. But the mechanism for delivery of the other intervention that has poor coverage is not as effective as the mechanism of delivery for the other one. And so you now begin to think, how can we integrate the two interventions so that the other one that has a low coverage can benefit from the mechanism of delivery of the other one with a very high coverage. So I give an example of what we've been working on in Nigeria, and that's integrating vitamin A supplementation with seasonal malaria chemo prevention campaigns. So over the years, seasonal malaria chemo prevention has been very successful in reaching children under the age of 5 across the Sahel. And increasingly, we are seeing the coverage really increasing. For instance, in Nigeria, as at last year, more than 15 million children under the age of 5 were covered with seasonal malaria chemoprevention. And so the question has been, what more can we deliver through that platform? And we began to ask ourselves whether vitamin A supplementation, which is a very high impact intervention, and it's easy to integrate and to deliver. It doesn't need any high technical expertise to deliver it. And so we started testing that out, and we found out that in a smaller pilot that we did, it was feasible to integrate that. But then when we finished that pilot, there were a lot of questions that were being asked. One question was, how much does it cost to really integrate vitamin A with seasonal malaria chemoprevention? Does it increase the workload of the community health distributors? And so many other questions around how do you really get it out there and ensure that you are improving the coverage of vitamin A, but at the same time, the people who are implementing it and the beneficiaries are accepting the intervention as an integrated intervention. And we've seen, from preliminary results that it's been really, really accepted as a good, mechanism of integrating the two.
Yeah, those are great points. So I think we talked about the decision-making process. I'm just looking at time and some of the questions. So maybe we can also discuss who are typically missed from this decision-making process, because we know for integration approaches, there has to be extensive consultation. So if Mandy, if you could talk about it, that would be great. Sharing your experience. Are there any particular stakeholders that are typically missed during the decision-making process? Or Phyllis, and anyone?
Yes, Pooja. Thank you. This is Phyllis. May I go ahead? Yes,
please go ahead.
So thank you very much. And I think your question was what I was actually going to propose for reflection. Because so we are in Ghana and we are currently working on the long-lasting insecticide nets for malaria. So we are looking at the campaign, that's the point mass distribution campaign. What we are looking at is how you get that transitioned or integrated into the primary healthcare system, so that beyond the campaigns, there is actually a structure that absorbs, and then we continue with messaging, you continue with information to the community. In all of this, and also the submissions that have come, I was beginning to wonder whether the decision-making processes involves any community structure at all. So that is one. And then looking at what we are working on, our concern has been, is there any point in time that structures become overburdened? So the structures that are absorbing the campaigns, the structures that are being used for integration, for transitioning, is there any point in time that they become overburdened? And if they do, what do you do about this? So that these are just some things for us to reflect on. Thank you.
Excellent point, Phillips. Anyone? Yes, please. Uzoma?
Yeah, thank you so much. The last two persons that commented actually brought out a few things that I would want to point out. So in Nigeria, taking from the experience we had with the polio eradication initiative and trying to tie the fact that you can have interventions integrated, but then if you miss out a bit of the sustainability after those interventions, it becomes a problem in the long run. One of the lessons we learned in the Northeast, so I work with eHealth Africa, we supported the polio eradication initiative in the Northeast especially, and we noticed that as we moved programming and implementation planning further down to the community level, it became easier for us to really know where we were to reach, children that were actually missed, and communities. So the major issue we had initially was, where are the locations that we actually have these children? So at the national level, you had a list of settlements. At the state level, a different list of settlements. At the community level, they had a very different list of settlements. So it was difficult to even know the real denominator to really know who you're reaching through an intervention. So we had to integrate engagement at the rural level to even have a baseline and ask the simple question, where are these children? You know, being able to answer that question in terms of location, we're able to now answer the next question: how many children are there? How many have been missed? How many are 0 doses? And stuff like that. And over a period of 2 years, we began to see the impact of having the community level. We involved traditional rulers also, even in the planning. We began to look at how to even integrate routinization generally into that entire process. And that helped a lot to begin to get them involved. And we noticed that even in cases where you had missed children, it was the community level decision making that even helped make sure the students were reached through subsequent interventions or even through revisiting on subsequent days. That was a very, very good decision strategy for us. So we did a top to bottom and a bottom to top approach at different stages of programming, and which was very, very key. Ideally, the National Primary Healthcare Development Agency is more interested in saying we want to reach this particular location. They hand it over to the state, and the state works with the local communities to decide where exactly these interventions are needed, where are the children, and things like that. The second bit to it was we realized that the need for data for this decision making was very, very key. It was very, very key. And one of the things we began to promote was using both electronic data, geospatial data, to track both reach and implementation. We tried that in the SMC in the past 2 years, working with the World Health Organization in Yobe, Adamawa, and Borno State in Nigeria, to see how those lessons from polio can also help improve SMC coverage. And that's actually helping a lot. So that community level engagement, having data come from that level and using it to make key decisions in subsequent programming are things that can enable us to really, really plan for this and effectively plan for sustainability. You don't just want to end at interventions, you want to integrate it into your primary healthcare programming, so that with or without those interventions, you can still have engagement. There's a current research going on now, starting in April, where we want to see how we can integrate azithromycin distribution into, say, SMC, into the EPI programming, into polio campaigns, to see how that really works and see the best way to begin to deliver that. Thank you.
Excellent. Thanks so much. I'm also looking at the chat box, and there's a question, very practical question by David. So he wants to, maybe I can just read out, can participants share examples in which Ministry of Health, communities, or partners decided that full campaign integration won't be feasible, or partial integration like sharing of tools, forms may be best? Any examples? Mandy, would you like to comment on that?
Professeur Mandikata Condé, vous êtes invité à parler en français, ça va, merci.
Sorry, I don't speak French, so sorry.
Je vais parler en français, ce sera plus simple.
I'm going to speak in French. It'll be easier and faster.
Yes.
I wanted to share our experience in Guinea with respect to decision-making in terms of centralizing. We have been involved in the preparations of an integrated campaign with meningitis and also rubella, and we had the advantage of having the communities input with measles and meningitis, and with the pandemic and with Ebola in our context and multiple epidemics, we were not able to sustain the campaign. It was rejected and several times delayed. So the initiative for us is to see, even if there is a risk at a national level, there's also risk at different levels. How can we manage the areas with a higher risk of meningitis and measles to make a decision and to make sure they can conduct their campaigns? This was an experience that was very important for us, and that allows us to call attention to the communities, for the authorities to pay attention to them, to accept these integrated campaigns. Thank you.
Great, thank you. Anyone wants to add anything? So otherwise, maybe we can move to another, I think, important question, which is, you know, in the last 2 years, I think the public health community has really come together, and I think the Ministry of Health has also sort of, you know, the culture of collaboration has very much been sort of there since the COVID vaccination rollout, and it'll be great for us to sort of discuss to what extent the COVID vaccination rollout you know, gave that platform the opportunity to work collaboratively within different management units under the Ministry of Health at different levels.
Pooja, I just wanted to let you have a 2-minute warning that we're going to move you very shortly into the next room. So you've got 2 minutes just to ease yourself ready to go into the next room. Thank you.
We've already, oh my God, okay. 25 minutes gone. Anyone, their last remark?
Yes, I'm Liban. I'm Liban Aden from WARA, Director of WARA, within a relief organization, non-governmental organization, and based in Mogadishu, Somalia. And I'm very happy and delighted to be part of this meeting, Health Coalition Campaign meeting. And I think it is the second time, and this year it's the first time, but last year we have participated the meeting, and we are happy, and we need to be part of every and every practice or every campaign that's intended to integrate in Somalia, whether it involves the coalition or not. And we are happy, and we now ready to take part. Thank you.
Great, thank you. Maybe I think we've run out of time. Are we switching now, Leah?
Yeah, so if you would like me to move you straight into that other room because you've come to a natural pause, I'll start you off, and then I will bring Santiago into this room.
Okay.
So there'll be a little bit of a delay. So for everybody else, just stay in this room just for a few minutes, and we'll just sort that transition out. But yeah, I'll sort that out for you now. Thank you.
Great, thanks everyone for a great discussion. Great. Hello, everyone. My name is Pooja Pandey Rana, and I work for Helen Keller International. I'm based in Kathmandu, Nepal. I'm also a member of Campaign Integration Working Group. I have the privilege of being your facilitator today for the second breakout session. So with the previous group, we had a really good discussion around decision-making process, and we talked about how decision happens at the mostly at the national level, and you know, one of the key factors we discussed was for integration, it should be win-win for both the parties. And even though at the national level, integration can look fuzzy, when it comes down to the community level, it is very natural. And we talked about different tools like the micro-planning tools, some of the digital tools, and we also discussed about cost being one of the key components for integration. If there's cost saving, if we can maximize resources, then that may facilitate integration and collaborative planning. So for the breakout session today, I think we'll reflect on the national policies, and you know, based on your working context, your experience, do you feel you have national policies that either enable or hamper your ability to implement integrated campaigns? So how do the systems you work within the Ministry of Health support or hinder your ability to collaborate? If there are any comments, and maybe we can also think about the operationalization of the plans as well, the national policies and plans. The floor is yours.
Pooja, I'm just going to interject here. I've been taking notes in the background during our first breakout discussion, and I believe this group that we just entered has been discussing the national policies. Can someone confirm if that's correct? That you dedicated your first 30 minutes here to discussing the national and global and national policies that could incentivize or hinder collaboration?
Correct. Yes.
Yeah,
sure.
yeah.
So then I think actually, Pooja, we can continue our conversation that we started with the first group and bring it over here to really focus on how the decision-making process, how decisions are made around integrated campaigns. So you and I have just had this conversation with others, but for this group, we'll bring them into the conversation. As you said, we focused a lot on or the responses from our first group were around kind of the finding those mutual benefit situations for different campaign managers or partners who are doing the collaborative campaigns. We talked a lot about the community level. I'm taking notes in the background, but I'll let you take it from here, and maybe we can bring this group into the same conversation and build on it. Thank you.
Sure. Thanks, Alison, for the clarification. So maybe we can start, one of the topics that we didn't really get to discuss in detail there is how we can support decision makers to facilitate shared strategic planning, to identify common barriers or common priorities for campaign integration, and how can we bring them together, or what tools are out there if we could share with each other based on experience, that'll be great. Anyone?
Yeah. Hello.
Yes.
Yeah. I will like to respond to the question which you just now raised in terms of decision making or bringing two campaign managers together in terms of thinking it as an integrated campaign, because people are conducting campaigns like polio campaign is separate, then the STH campaigns are separate, vitamin A campaign is separate. We need to bring them together. Bring them together. The only thing is the word which you mentioned is, everybody should feel kind of a win-win situation. Otherwise, why should I, join hands with you unless there is a benefit to me? So that means, while bringing stakeholders together, we really have to demonstrate that this particular approach is going to be win-win situation, because the health workers will be spared for a routine work. Otherwise, the health worker will remain busy for various campaigns. And we may have to mention that every campaign, it is not a 2-day campaign or a 3-day campaign. Every campaign requires a dedicated pre-planning time, maybe 2 weeks, 3 weeks, or maybe 4 weeks are required. So I think campaigns are very costly affairs. That message must be communicated. And if you really are interested in cutting costs, reducing cost, improving efficiency in the system, making your healthcare workforce, available for routine, healthcare, then the way forward is integrated campaign. So we have to sit down and make them understand. And I think most of the people will agree, and we might have to give some examples that this is the population we are, trying to reach. So we go from house to house, collect information. Now, why should for every campaign the information may be collected? Information may be collected at one go, which helps every campaign a person. So I think there is a sense, but I think that's why I'm using the word repeatedly. Strong advocacy is required, at every level. At the national level, once we go to the district level, we need advocacy, and that's why I think advocacy tools are really very important, are critical for the success of this campaign. Over. Thank you very much.
Great, thank you, Ajay. I think the other factor we discussed, when we're talking about integration, whether it's at the system level or the service or tool level, is overburdening the system with lots of like integration components. So if anyone could add or share the experience on that, looking at the frontline workers, time or just more management burden that may hinder collaborative planning. So if anyone has any thought on this.
This is Alan Hinman. To build on what's been said before, it seems to me that not only do we have to try to demonstrate how this can be a win-win, but we first have to reassure that it won't be a lose situation. I think one of the things that comes into a program manager's mind when you talk about integration is, I'm not going to be able to do as well as I used to because I'm going to have to be doing something else as well. And so I think we have to start in some ways with a nearly defensive posture that integration does not necessarily mean that you're not going to be able to achieve your goals.
Excellent point. Any additional comments, thoughts?
There was one comment in the chat, Pooja, I don't know if you've seen, from Sangeeta.
Yes, yes, around using data analytics and use of, use of digital technology. We can no longer ignore these tools as the planning is more complex. Exactly. Would you like to elaborate on that, Sangeeta?
Yeah, I think we really got to think about, if we're going to think about integration, we really got to think about it from a complexity perspective and really then start looking all the tools that are out there. And I know there's a lot of work being done, including ours, that is trying to use AI and data analytics to really help with the planning process. So one of the things that the coalition could really help is really having this list of tools that are out there that would really help us, because there is a lot going on right now. But I think we can no longer just do it like we've been doing, taking the old components and doing it the old way. I don't think it's going to work. And I have no idea how to take my yes off.
Yeah, so maybe building on Sangeeta, so what kind of planning tools can help making decision-making process easier? Not just at the national level, but also at the subnational level and at the local level, because the issues and the functions may be different. So we may need different sort of tools at different level, depending on the functions.
Sorry, could I just, sorry, I'm just going to add in there. I mean, we know we need different function tools at different points and places like that, but we definitely need tools that are getting the work pre-done for them. For instance, you know that for planning, you're going to need some kind of population data analytics, going to need supply chain data analytics. That can we be pre-done, right? It's not going to change significantly. So tools that actually reduce workload for health workers, I think is critical. The second thing is that I think we really should be using cell phones and mobile to collect real-time data, because our part of the other problem we have is that there is really a disconnect. It takes 3 months before we get the results of what we did to then learn from it. And what we really should be looking at tools that we can get the results there and then, so we can actually adapt our campaign as we are moving forward.
We lost
Pooja, did we lose Pooja? I think we may have. Well, I can step in momentarily, and maybe I'll look to you, AJ, and others for support. But as I've been taking the notes here, I was just scanning to see where there may be opportunities to drill in on some of these ideas. So we've raised primarily here from you all, and thank you, we've raised advocacy as it relates to bringing decision makers together. We've raised the tool or tools component. I'm wondering, I'm focusing, I have this this grid that I'm filling in as we discuss, where I'm noting some existing enabling factors, existing hindering components, opportunities that we're hearing. And then really where I've been focusing is in this last quadrant where we're capturing some ideas on what the coalition can do to support change. So maybe we can drill into some more concrete examples there, or suggestions or ideas. You know, we have the advocacy idea, the tools. Are there other suggestions or ideas from the group in any of these, you know, 4 domains as it relates to decision making? But I'm especially curious here about what can the coalition do, all of us here together and our broader kind of base. What can we do to support change, to enable some, you know, to remove some of the barriers that may exist around this integrated decision making? In the chat, I see, thank you, Russell, that you're looking to get Pooja back. We hope she can join us again. And I see another kind of question, you know, prompting question, requesting if we could get more specific about advocacy and what that may look like for the coalition.
Ali, I added that question because I assist the coalition with communications. And we've thought about advocacy for a long time. And I'm just curious with this group, since it's been spoken about a lot about advocacy with the funders and with the countries. How could the coalition play a role in that? Like, is it as simple as creating messaging, or is it something much more involved? I'm just eager to hear your suggestions and what you might think could work.
You know, may I respond, Jessica? Hello?
Yes, please. Mm-hmm.
No, because, you know, to be very frank, advocacy is required, and the specific advocacy is particularly what the coalition can do is, you know, collect, you know, some kind of a real evidence in terms of, you know, measuring the effectiveness of this integrated campaign versus the vertical campaign. You know, we are doing some effort in terms of collecting the best practices. That was one exercise which was done in the past. Now it's high time that we must, suppose in 10 places in the world where integrated campaigns are happening, we have to measure it, you know, from a cost effectiveness point of view. How much money you have saved and how much time of the workers you have been able to save. You know, we will have to drill down and collect that information. And once we collect that information, that has to be converted in the form of advocacy. That, you know, we have experiments, so this is the way things are, and people will get convinced, you know. But just by saying that we want integration, that is not enough, because people have, even I'm reading the chats also, chats are raising, you know, so many questions on the overall integration approach. So I think it's high time that the coalition must do those kind of, you know, learning and collecting data sets that will help you in building the good, you know, case in point, you know. Over.
Thank you, AJ. Other thoughts or comments regarding this point or others that have been raised?
Well, if I could just say that, in fact, the program office is trying to gather this kind of information. And that's one of our major activities. I think a specific approach to advocacy that the coalition might be able to undertake could be to get the leader of one of the campaign areas, say the leader of the Global Polio Eradication Initiative or some such person, to, in essence, make a testimonial about how, from the perspective of the Global Polio Eradication Initiative, it is advantageous to collaborate with others and to integrate activities. And that's something that it might be easier for the coalition as a coalition to do than for an individual country or an individual program manager. Over.
Thank you,
Alex, to
Alan.
drop in here, just say we've got 2 minutes or so until we're going to head back into the main room. Thank you very much.
Thank you, Russell. We'll attend to the final question that's in the chat then from Ruby. I'm sorry, I don't see your last name, Ruby. Please, can some sustainability ideas be shared that can help effectively sustain these campaigns within communities? Ruby, would you like to share any other thoughts before others may answer this, and then we'll wrap up?
Hi, so I wanted to hear the ideas from others. What's other forms of sustainability that they think other people can adopt to sustain these campaigns that are ongoing in the various communities?
It's a challenging question to answer, but maybe if there's one or two examples that folks could share, this would be a nice way to conclude our discussion.
I would differ a little bit and say that in many areas, I think the idea should be, how can we go beyond campaigns and not have to depend on campaigns in order to achieve our goals?
Absolutely. Good.
I have a comment here from, and it's paraphrased, apologies, from our first round of the discussion from someone who's based in Nigeria, who said, we don't just want to end at campaign interventions. We want to get to primary healthcare integration and sustainability in that lens. And this is just Alan's point. Thank you all for the discussion this morning and for joining us. And we'll be sharing all of these notes and suggestions and taking action on your suggestions in the coming weeks and months. Thank you. I believe we return to the main room at this time.
Alison. Thank you, everybody. You can return to the main room now, or in the next 36 seconds, you'll automatically be moved over if you haven't already done so. Thank you very much.
Alison, I had a brief comment for you since you were talking about costs, and I know Chris was mentioning the financing work. One thing that we may want to look at is not only at costing integration, but also how does costing of integrated campaigns compare to routine service delivery? So I'm thinking, for example, BedNet campaigns versus routine BedNet distribution.
Yeah. No, that's a great suggestion. Thank you, Richard. I'm going to